Good morning. Hey, gang. This is Intellectual Medicine. We're getting ready to launch our morning show. Thanks for tuning in, and thanks for telling your friends. And don't forget, Wednesday at noon, Facebook Live, Intellectually Speaking.
And your podcast.
And we have a podcast?
We do have a podcast.
That's pretty cool.
WPRO, its management, or its staff. News Talk 630 and 99.7 FM. WPRO presents Intellectual Medicine with Dr. Petteruti. Join Dr. Petteruti as he guides people towards living the 120 lifespan while retaining youth. He'll apply logic, reason, and scientific evidence to address conditions that drain people of their joy and vitality while protecting people from the harmful aspects of conventional medicine. Now, here's Dr.
Regenerate, don't replace. Good morning. I'm Dr. Steve Petteruti. I'll explain that phrase in a moment. Stay with me. It's a great day in southern New England and throughout this great country. Shannon, it's a great day to be an American. We celebrate freedom, and the price of freedom is constant diligence. So we're going to talk about that today. Where are the threats coming from? And what's the connection between Mayor Solomon getting reprimanded for used car sales and your freedom to experience access to the healthcare you want? There's a connection, and I'm going to make it for you. And we also need to warn our listeners about medical procedures that are widely popular but can do harm and have no proven benefit. That's right. Insurance reimbursed procedures that are extraordinarily popular can do harm and have little to no proven benefit. And there always needs to be consideration for alternatives. What else can be done? So what are we talking about? The diligence required to preserve your freedom. And what about the connection between the mayor? So did you hear about this, Shannon?
No, I'm dying.
Well, the mayor of Warwick is also a used car salesman. He owns a used car lot. And he recently had a little bit of a dispute, a little bit of a run-in with the board of used car sales. There's such a thing out there. And they gave him a warning. Now, the threats to your freedom are unlikely to come from the Russians pouring across the Alaska border with bayonets drawn. It's not very likely that we're going to see a horde of Canadians invading Buffalo. The threats to your freedom are insidious, and they nibble at the corners of your life every day. We talk often on the show about the tax burden. Anybody who takes your money takes some of your freedom with it. And this needs to be guarded, not because you're mean, evil, or selfish, but because you love freedom. And I believe that most citizens can do better with their money than the government can. Now let's look to another arena, though. Think about that story for a minute, Shannon. What strikes you? That the mayor of Warwick called in front of this board of used cars. Why is there a board for car sales?
Come on. I'm sure they have to pay dues or something, right?
I'm certain of it. But here's the creepy part and the part that connects to your health care. Boards are created to a certain degree out of sloth in government and police. They just don't want to have to manage certain things, so they create a board. Seems reasonable. If a car dealer is doing something wrong, it should be a matter of the law, not some little goofy board with quasi-powers. Those quasi-powers are not accountable and are insular. So the board makes up its own rules, and it has the power of law, and it has the ability to dispense consequence that is more severe than a legal proceeding. So now, in my opinion, we should be really deboardifying the state and the country. Every time you create a board, you're outsourcing this power. Now, what happens to power? It consolidates. It gets greedy. Power wants more. The only thing that heads it off is confrontation. There must be somebody at the point willing to take on the power. Now, we've been warned on this show by others, by some of our faithful listeners. By the way, folks, thanks for tuning us in. Thank you for telling others about us. This is one of the most widely listened to health talk radio shows on the air. And we respect and value your faithful listenership. You know that we've come to be trusted as a credible source of information. That's why, with great excitement and balance, we're going to announce our new sponsor next week. Don't worry, it's not selling out time for us. We're not writing the big check nor receiving one. And there's a special kind of sponsor, and you guys, I think, will be pleased to hear of it. Do we want to announce it next week, Shannon, or should we do it on Wednesday?
Wednesday.
So Wednesday is
Your
yeah, tell us.
your podcast. It's when your podcast goes live, and we're also on Facebook Live.
Okay, so how can everybody tune us in on Wednesday?
You can just go to Facebook and go to Intellectual Medicine.
And watch Intellect or listen,
Or
either way.
listen.
Yeah, so
Yeah.
we'll pick on some of these things, but let's go back to the board.
Okay.
So a board is created. Now, we've been conversing about the Board of Medicine in this setting. They have an important and useful function, and they were created in order to make sure that dangerous practitioners were addressed and that critical healthcare needs of the state were addressed. But something happened on the way to their virtuous objective. Power. It grew and expanded and became more intoxicating. Now you have a board that, number one, makes up the rules. Number two, interprets the rules. Number three, enforces the rules. Number four, makes up new rules where those don't exist as needed to address a circumstance it doesn't like. Then it adjudicates the offense. Then it hears the appeal should one be needed. Of course we're talking about us. Of course we're talking about our relationship with your Department of Health and how it affects your freedom and access to the type of healthcare you choose, the type of health you define. You see, in medicine, there's a standard of care. Well, we practice standard of care medicine. That is the base of what's needed, that is widely recognized as necessary. So, for instance, if you come in with strep throat, you're treated with penicillin, that's a standard of care. At intellectual medicine, we'd go beyond that, and we'd say, you know what? The antibiotic is going to ruin your colon regarding its bacteria. We're going to help you with a super probiotic to support that. That is not standard of care, but it's good medicine. We're going to talk about that in relation to prostate cancer, one of the areas in which standard of care medicine does harm, and we need alternatives. So if we get shot down, and trust me, there are powers out there that would rather see us off the air and closed. In fact, they have made that clear and have posed that as their intent. And that's what we are now advocating, the right and the privilege to practice and to continue to communicate with you in a manner that is honest, transparent, and free. This is a freedom moment. So the boards are a threat. They grow in power. They become insular. There's no consequence to a board rendering a decision that is sideways or irrational. There's no rebut to that. You can theoretically go to a state or federal court, good luck. The minute you start down this journey, the doctor starts writing a check of $50,000 and it goes up from there. They know this and they use it to crush oppositional thought. It's not that there are doctors doing things wrong in most cases. They're doing things different. And different sometimes is fabulous, especially if you're one of the people who benefits, like at intellectual medicine, like anti-aging therapy. I mean, really, who wants to get old passively? Shan, do you remember? Now, we still have a sign in our office, Life Extension Medicine. And Shannon's laughing because an auditor from Blue Cross came in, he saw the sign, and he said, "You're not practicing primary care." He goes, "You should take that sign down." I said, "Oh, what would you like me to replace it with? One that says life-shortening medicine? Would that be more appealing?" No, this is a new age people.
He was so annoyed.
Yeah, he didn't like that, did he?
No.
Yeah.
That was fun.
We were invited not to play in their sandbox, but that's okay. That's all right, because science is moving faster than really medicine wants it to, and the powers that are trying to restrain progress, well, they're inviting us into the dark ages if we let them, and we're not going to let them. But when we come back, people, we have to take a short break. We'll be right back. We have to talk about assisted suicide in New Jersey too, and the horror that's happening in Brunei, a genocide that's occurring you must know about. I'm Dr. Steve Petteruti. This is Intellectual Medicine. We'll be right back. Brunei, what the hell is Brunei, right?
Before you take the headphones out, I just
Yep.
wanted to remind you from last week, I don't know if/when, but somebody from the Rhode Island Center of Freedom and Prosperity had called, and yeah, just giving you that reminder because you would call back this week.
Yeah, if they call back, we'll probably give them some airtime. during the last segment. So if they do call back, let them know we want to put them on the air, and then I'll be able to build it into my flow. Okay.
Joe has a excuse me, a question. He says, if someone has a hiatal hernia and struggles with acid reflux, what would be the best way to neutralize symptoms without prescription meds? And
So the question is a hiatal hernia with acid reflux. So let's separate those two things. Frequently, people with acid reflux have an evaluation performed, such as a scoping procedure or an upper GI. Oh, I'm being signaled by Tyler. Hey. Hey, Ty.
Hey, we're going to be back in a minute and a half.
Okay.
Sorry, I'm going to confuse you and myself by explaining a minute and a half.
Good enough. You just let me know when I'll go.
Yeah, you've got it. I had to rearrange some commercials.
Okay. So anyhow, hiatal hernias are extraordinarily common. If you did them on people without symptom, probably 40% of the people would have one to some degree. A hiatal hernia does not necessarily create the reflux. The reflux creates an investigation that coincidentally can find a hiatal hernia. So number one, you need to be at your best body weight. Percent body fat correlates with reflux. Number two, we recommend a food inflammations test. At our center, we do a food inflammations test to find out which foods are most pro-inflammatory in your gut. Nutritional modification can help. Number three, I really like a high-quality probiotic. And in some cases, a medical food, an anti-inflammatory protein powder can be of help. And finally, you have to look at your thyroid. A lot of times, the thyroid is not adequately functioning, or at least not at a level that is ideal to maintain gastric motility. The thyroid stimulates movement from north to south. That's called gastric motility. And with that movement, you get reduced reflux symptoms. Another easy trick, you simply raise your headboard up a couple degrees. Pillows don't work. You need to put a little prop underneath the headboard. 2 or 3 degrees at night is as good as drug therapy. Hope I hit the button there, buddy. Thanks for listening. So what are we going to do? We're going to talk about New Jersey assisted suicide, or Brunei. We are back. So New Jersey assisted suicide. And no, it's not because they live in New Jersey that they want to commit suicide. This is a serious issue, though, really. Poor New Jersey, they got all these jokes.
they really do.
But they got their tax bill and people are jumping off the buildings. No, so New Jersey has, look, let me put it out there. Assisted suicide is a horror show. It is misinformation, fear mongering at its worst. We shouldn't be inviting people to kill themselves out of fear of what comes next. The sad fact is we're all going to die. When we have a terminal diagnosis, the horror and fear of losing independence, suffering pain, starts to become preeminent. I maintain that assisted suicide in a country like the United States with a flawed healthcare system becomes an opportunity for financial coercion. Picture this. You're a loving father. You have a family. You've been diagnosed with terminal cancer. You no longer can work, and for the next year of your life, your family's going to suffer financial hardship as your income evaporates and the cost of your care escalates. You have a life insurance policy. You're going to die. The only question is when. It might be a noble gesture, not so much suicide as Harry Carey, to say, you know what, I'm punching out right now. That's kind of sad. No person should be put in that position. None. But let's talk about assisted suicide. I can't stand this trend because it devalues the joy of today, right? We have today, tomorrow is uncertain. Now, I have this patient, I got to share this story because we're talking about quality of life. We're going to tie this into futility of treatment, and before the show ends, I hope to get to the role of what they call palliative chemotherapy. This is when you're going to die, and they give you a little chemo to try to, make things last longer, right? That's a lie. Palliative chemo makes people worse, and there's a better approach. So we had this patient, she came to see me. Now, she was receiving intravenous vitamin C. She had stage 4 breast cancer. Now, people, just so I don't get shot on my way out the building, vitamin C is not FDA approved to treat any disease, and it does not cure cancer. Okay, can we move forward now? Intravenous vitamin C, however, has been shown in many studies to diminish symptoms of cancer and chemotherapy, improve energy, improve vitality, and yes, it's been shown to be active against many forms of cancer while not harming the body. Enter the patient, looks at me, and she's feeling pretty good. She drove into the center. She said, I'm thinking of going to Bulgaria. I said, what? He goes, yeah, they have oxygen immersion therapy. And I had to pull her aside and explain very gently to her that it was unwise to go to Bulgaria because she probably only had a couple of weeks to live. And she looked at me in shock. She said, but I feel good. I said, but her liver had failed at that point. She was yellow, and clearly her last days were in front of her. She did, in fact, pass 2 weeks later. The moral of the story is not that she died, but how she lived. We can do more than just pump you full of morphine towards the end. The vast majority of patients suffering with cancer in particular and other forms of disease challenge us to find a way to support their vitality rather than just invite them to leave the planet early. This is a missing piece. It's a missing piece in many chronic disease treatments. It certainly is a missing piece in cancer treatment, and that is the rest of your body vitality. The drip bar exists in part to try to address that need with innovative interventions. Dr. Michael Souza with his drip bar in East Providence, and our drip bar, along with your oncologist, your traditional medical team, working together. I maintain that we can keep the vast majority of people feeling great right up until the very, very, very end. And if it's me, I'll take that bargain. The real problem is these financial coercions that happen. But we got to hit some other topics, and I see we also have a caller. Ty, what do you got going on, buddy? AFib, well, it's kind of apropos. Let's bring it on. Let's bring Jim on and talk about AFib, and then we're gonna circle it back to ablations. Good morning, Jim. Thank you for tuning in. I appreciate that. Okay. Right. 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 I got you. Well, you know what? Let me talk about AFib, Jim. I'm going to pivot to that topic, and you can listen as I talk. But let me ask you a question. Do you have diabetes or have you had a heart attack? So you're otherwise a pretty healthy guy. Did they happen to tell you what your CHAD score was? That's C-H-A-D, CHAD score. Right. Well, let me summarize it for you, though, because we know you're an AFib, all right? That's a given. The real question is, does the therapy have any value? And I'm going to turn my answer to that because they're two separate questions. And thanks for calling, Jim. And on Wednesday, we'll also be on Facebook, and we're going to be talking about this because there is, if you will, an incentive within the medical establishment in favor of interventions. This is a general truth. If you're given a circumstance like atrial fibrillation, now the reason AFib occurs, nobody is absolutely certain of. It may have something to do with the stiffening of the myocardium and interference of the electrical pathways. We have found at Intellectual Medicine that some of our patients respond favorably when they're given intravenous micronutrients that have antioxidant properties. Some patients have noted favorable response when they take high-dose coenzyme Q10 on the order of 200 to 600 milligrams a day. Magnesium supplementation has been correlated with improvement in cardiac conductivity. especially in athletes. Athletes tend to be low in magnesium, and you cannot trust the blood test because most of the magnesium is inside your cell. Now, magnesium can be taken almost at an unlimited amount, 2, 5, 600 milligrams a day, as long as it doesn't upset your stomach. At Intellectual Medicine, we'll put a magnesium 1 to 2,000 milligrams intravenously. Now, these are not known to be cures for AFib, but the real question is this. When a person has atrial fibrillation, an irregular beating of the heart, it can cause symptoms because the heart can race. Now, that racing can be sporadic or consistent, and on occasion, there are drugs that can control the rapid rate. There's a host of them. However, in some cases, the atrial fibrillation is asymptomatic. You don't even know you have it. It gets picked up coincidentally. If you're otherwise, the CHAD score is one of the tools that doctors use to judge the risk of bleeding versus risk of clotting. So when you have AFib, the risk of a stroke, of blood clot, increases a little bit. It increases more so if you have abnormalities of the heart, abnormal anatomy of a valve, prior heart attacks, etc. For each risk factor, the potential for stroke increases. The blood thinning treatments have risk of bleeding, including intracranial bleeding. I heard Jim say he likes to ride his bike. Well, guess what? If you fall on that bike and bonk your head, you could bleed inside your brain and have sudden death. That's a risk of taking the therapy. The risk of not taking the therapy is potentially a slight increased risk of stroke, but even that is uncertain. Now we have ablation therapy, where some doctors say, I can go in there and I can electronically zap the aberrant pathway and control AFib. Problem: a study has shown the procedure has no value. It didn't work in suppressing AFib. Another problem: when you do the procedure, there's a risk, potential heart attacks. That's not a good bargain. So the number one thing that people need to do when you have a relatively benign condition, Jim, like the one you have, is take a step back and really scrutinize, is the treatment worse than the disease? We'll talk about other examples of that, including cardiac stenting. We advocate chelate, don't ablate. You like that, Fred?
It's so cheesy.
It is cheesy.
I like it though.
So intravenous chelation is a complementary treatment where we do vitamins, calcium EDTA. It's instilled through the vein, and it's been shown in double-blind placebo-controlled studies to diminish heart attack, stroke, and cardiac complications in people with prior heart conditions. We advocate this as a lifestyle anti-aging health support, even though the data on it is good. We don't have proof that it will extend your life, nor do we have proof that it'll make your heart stronger. We do have proof it'll lower lead, which is a cardiac toxin. So look at the bigger picture. Don't just look at the AFib. Celebrate all the healthy things you're doing and take your best choice, avoiding drugs when you can. Based upon what I know about Jim's description, Shannon, I'd be very, very slow to put him on blood thinners, just because the risk of bleeding is higher if you're more physically active. We need to talk about prostate cancer in order to save people from from fruitless treatment. And shoulder surgery too, Shan. New study out on shoulder surgery and shoulder replacement in particular. And a couple other hot topics. There's a new drug out that a new oral testosterone we may want to talk about as well. But first up, from the Revolution Softwash News Center, it's Doug Lizette with the headlines. Good morning, Doug.
Danielle wants to know your thought on root canals.
Wow, what a loaded topic, huh? So root canals are commonly performed in dentistry. They've been associated with increased cancer risk and increased inflammation risk. One of the concerns is that the root canal creates an abnormal anatomical situation where the bacteria can flourish beneath the root canal itself and can increase the risk of cancer, in particular breast cancer. Now, we've seen cases of women that have had a root canal and a few years later develop breast cancer on the same side as the root canal. I'm not aware that this issue has been thoroughly researched. My advice when it comes to procedures like root canals where the benefit is uncertain and there's possibility of risk is to get multiple opinions. If you see your dentist and they say you need a root canal, I'd want to know from 2 other people if that's the best path forward. And I want to know what my alternatives are. Personally, I don't think I would do a root canal. You know, Shan, I don't think I would do it.
What would you do?
I would find an alternative. I mean, if the root canal is being recommended to me because of, well, like my dentist wants to do, like, and I love my dentist, good guy, keeps my teeth in shape. Wanted me to do a panogram, you know, the x-ray. No thanks. Was telling me I had receding gums, right? The first time he saw me, that was 10 years ago. I said, how do you know they're receding? You've only seen them once. Subsequently, no change. So when it comes to root canal and dental health in general, we advocate, I know this is going to sound tangential, hormone support so your bones don't decay. So we'll talk about testosterone and the connection between that and the researcher from the FDA.
How much research is done on that silver?
Colloidal silver, there's not a lot of research on it with regard to gingival preservation. What Shannon's referring to is the knowledge that your gums are chock full of bacteria, even when you have compulsive oral hygiene. And that bacteria can lead to tooth decay and infection. In many cases, we've advocated for a spray that we have. It's a spray form of colloidal silver, swishing it between the teeth and in the mouth in order to control bacteria, virions, and other inflammatory components. So an alternative approach would be colloidal silver, hormone replacement, trying to regenerate the tissue in the mouth. Sometimes if pain is the motivating instigator, little choice but to go forward with a root canal. However, if you're going to do that, and we know that there's a possibility of increasing subsequent adverse events such as cancer, well, then you do things to make yourself less likely to catch cancer. And we talk about this frequently. Control your percentage of body fat, get the cadmium and the lead out of your body. You should get heavy metal testing performed, urinary-based heavy metal testing after provocation with calcium EDTA. And everybody in the country should be doing some degree of intravenous chelation and or far-red infrared saunas as a means of detoxifying.
That we now have?
We do at Intellectual Medicine. We do have the infrared saunas, a beautiful adjunct that can help rid the body of heavy metals. It's complementary to a lot of the IV therapies we do. We're offering it now to our patients fighting chronic Lyme, our patients fighting cancer, because it's been shown to reduce toxins, increase body temperature, and stimulate immune function. So in some cases, we have known risk factors for cancer. Maybe you've had cancer before, maybe you had to get a root canal, maybe you're on a drug that's suppressing your immune system. In those cases, we need to counteract that risk with other activities. Drug company that paid, we could talk about the cancer drug company connection. We do have to talk about prostate cancer, though. And we have to talk about the testosterone pill.
Yeah, you gotta talk about that. That whole link.
Brunei, Southeast. Oh, we got to talk about Brunei. I mentioned it and I didn't complete the thought. We'll start out with Brunei because that's just a genocide happening and that's disgusting. Maybe Duke's $112 million fine. We could tie that into the purchase of the drug. AstraZeneca did $6.9 billion to buy a cancer drug. They're predicting the market for it to be $3 billion a year.
10 seconds.
Give us a call today at 508-509-4414.
Now back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
Don't just do something, stand there. When doing nothing is better than exposing yourself to the risk of medicine. You know, it's been said that if it were listed as a cause of death, medical care would be number 3 behind cancer and heart disease. But if you're in Brunei, that's the least of your worries. Brunei is as I read it, people, a hideous little country tucked away in Southeast Asia a perverted little kingdom that has a new law that not only makes being gay illegal, but subjects the perpetrator to death by stoning. That's right. If you're caught performing a gay act in Brunei, who the hell knows how they'll define that? What, do they have cameras everywhere? This is gross. Oh, by the way, if you're caught in adultery as well, and when we say adultery, people, don't forget, this is Brunei, where they are practicing Sharia Muslim law. It doesn't apply to men. That's just in general, Shannon, I'm telling you. You know, you screw around, you're getting stoned. Me, I get a bonus. But in Brunei, now not only are you getting stoned to death, but it must be witnessed by a group of Muslims. Why? I don't know. People, this is genocide. This is a crime against humanity. The Sultan of Brunei should be dragged in front of the world court and subjected to trial. The country should be cordoned off. This is like Dachau. If they said we're going to round up all the gays and bring them to a gas chamber, it would be more humane than this grotesque law. The entire world should be focused on this issue, and we should be horrified by it, and we need to draw attention to it. It bothers me that it's gone below the radar, and most people are not even aware of it, because Brunei is a little tiny country. Suppose this happened, in Israel, and they said, we're going to start to stone people. Well, you know, the Old Testament, it calls for stoning. They could point to that as justification. No, there's no justification, people. This is genocide. This is crimes against humanity. This needs to be stopped. You know, you don't get to live to be 120 if you get stoned to death. So people, tune into that issue. I say let's advocate to our congressmen, to the senators. I say to the state of Rhode Island, I would welcome them passing a resolution condemning Brunei, drawing attention to this action. I could talk about that more, but it bothers me to my bone marrow. This is just horrible. But beyond that, we need to talk. What are we talking about, Tex? We got Brunei. How about the new drug for the first new testosterone replacement in 60 years has been approved. I'll tell you why I don't like it. You don't have to beat an opinion out of me, huh? The name of the new drug is Jatenzo, Jatenzo. Why don't I like it? Number one, it's an oral form of testosterone. Horrible. One should never take testosterone or estrogen orally unless it's essential, such as in birth control pills for young women. Testosterone taken orally increases clotting and hypertensive risk. When it's used either topically as a cream or injectably or as a pellet, those risks can be markedly diminished, if not fully eliminated. Now, it was interesting how this process unfolded. One of the members of the FDA was against it, Dr. Doug Bauer from UC San Francisco, a very highly esteemed specialist, internal medicine doctor, a very amazing career, widely published. But here's the problem, people. He said that this drug, testosterone, is widely being used off-label. That sounds insidious, off-label. Well, off-label is simply using a drug for a purpose other than that which it was originally approved for, if in the judgment of the doctor, it's in the patient's best interest. The entire practice of intellectual medicine is built largely on off-label use, including testosterone, which we maintain every man and woman in America should be on at some point in their life, or they will suffer a negative consequence. But Doug Bauer is worried about that because it may be used for anti-aging purposes. Doug, that's the point. We want to use it for anti-aging. Our patients are happy not to be aging, Doug, and we don't want you prohibiting it. Well, let's follow the doc. I did some research on Doug, and like I said, I envy his career. He's got lives at probably a nice house overlooking the Pacific. He's probably goes to work every day at the university, does research. He gets grants from big pharmaceutical companies to do research. That's cool. Shannon, I want you to apply for grants. I want to do research. Can you do that? No, we're not this week. Anyhow, so there's Doug sitting over his veranda looking at the Pacific, and he's against it. You know what his area of research is? Osteoporosis, bone thinning. You know what causes bone thinning? Lack of testosterone. You know what the standard of care is to treat osteoporosis? Drugs called bisphosphonates like Fosamax. This class of drug is FDA approved to treat osteoporosis or thinning bone. We maintain in intellectual medicine it's a hideous drug with horrible side effects that should never be used. Just about never, almost never. Why? Because the off-label use of testosterone and hormone replacement will obliterate the need for artificial drug therapy as you naturally preserve bone by replacing the hormones that are missing. Well, of course, Doug wouldn't be happy about that approach. He's getting paid by Merck to do his research on Fosamax. And if an alternative treatment, a non-FDA approved treatment like testosterone were to ever catch fire, the multi-billion-dollar market for these crappy drugs would go away. So when patients start on hormone replacement therapy, I tell them, you should never get another bone density study ever. Well, why not? Because your bones aren't going to thin, period. Testosterone preserves bone strength, estrogen prevents it from being absorbed, and progesterone stimulates new bone growth. We track muscle mass. Muscle correlates with bone. You don't need to be x-rayed in order to evaluate the inevitable. So this is how, and by the way, Dr. Bauer, I'm not suggesting he's unethical. He isn't, by all appearances. He is simply reacting to the incentives placed in front of him. I refer to this as myopic self-interest. A myopic self-interest is when you have an area of interest that you focus on that prevents you from seeing the big picture. At Intellectual Medicine, we advocate for an enlightened self-interest. So let's look at other examples of myopia. Shoulder replacement surgery. Your shoulder hurts, you're 55, you've got crepitus, when you move it crunches, you've had pain medicine, it's not working, you can't throw a baseball like you used to, you go to see the orthopedic doctor. Orthopedic doctors are wonderful, but they all have myopia, right? They just narrow in on the joint. Says, well, you know, your joint is arthritic, it can't be fixed, so we're going to replace it. Replace biological regenerative tissue. Now remember, I said regenerate, don't replace. Until you've given your bone, your joint, a full, vigorous opportunity to regenerate, you cannot get rid of biological tissue without negative consequence. What do I mean? Plasma injections have been shown to stimulate regeneration of joint. We use them, though they are not FDA approved, we use them off-label in shoulder joints, along with testosterone to stimulate muscle development. In some cases, we use supplements to enhance growth hormone, which is restorative in nature. You do that and you are patient over time, your shoulder is going to get better. Those infrared saunas improve shoulder conditions, improve muscle tendon pain. Now here's the by the way, Jim in Florida, we're going to tie this into the issue with your AFib. 1 out of 4 younger men, but younger meaning less than 60, who received a shoulder replacement had a revision of that surgery within a few years. That means 25% of the people had that apparatus removed. Now that doesn't even begin to count the people who just suffered with a bad outcome and said, screw it, I'm not going to bother going back. Shoulder replacement surgery has increased sixfold since 1998, sixfold increase with no study demonstrating its benefit, none. Why? Because it can be done. Why? Because there's a myopic self-interest. Why? Because not enough clinicians take a step back, have the time and the resources to implement integrative treatments that can regenerate the tissue like Dr. Souza does, like I do, like other doctors practicing forms of intellectual medicine do. So I'm not telling you to never get your shoulder replaced. I am saying time out, think about it, get a full evaluation of ways to regenerate that joint. My own joint, I've been doing this for, I've got bone-on-bone arthritis in my shoulder joint. For a year, I couldn't bench press. I went through regeneration, and now I'm back up over 300. I had to get that in. Yeah. my 60th birthday. I should bench press 300 again for my 60th.
You should. We should record.
Put it okay. All right, we got to take a break though. I'm done bragging. We'll be right back. This is Dr. Petteruti, Intellectual Medicine. Stay tuned.
Danielle wants to know, can someone take hormone therapy if they have a blood clotting disorder?
If they have a blood clotting disorder, yes. The short answer is yes, you can. The idea that hormone replacement therapy escalates blood clotting risk is largely based on older studies using oral forms of artificial hormone. The benefits to be had regarding hormone replacement are so overwhelming that even if there's a small risk, it's outweighed by the benefit, in my opinion. Now, the Prague conference done in around 2015, which is a collection of specialists in testosterone therapy in particular, weighed in on this topic, and their consensus opinion was that the evidence did not support increased risk of heart attacks, blood clotting, or prostate cancer. We don't have the absolutely definitive answer to your question because it hasn't been studied, nor is it ever likely to be. But when we look at the trend in the literature and we look at the mechanisms of action, I would advocate that it can be done. Now, obviously, your circumstance needs to be looked at on an individual basis, studying the type of blood clotting disorder and the things that are being utilized to try to mitigate that risk. But, one of the biggest risks of blood clotting is lack of movement. Jim was talking about his AFib earlier, and the guy sounds like such a stud. Congratulations on your lifestyle, Jim. I mean that. That putting an active athletic guy in a blood thinner is a huge risk in my view, unless the risk of clotting is overwhelming. So we need to look at, for instance, how do you prevent blood clots from happening? Well, even if you didn't have a blood clotting disorder, physical activity, keeping a lean body, these are all cornerstones of your wellness and maintaining blood circulation. Hey, I get it. Blood clots are scary. They happen like a lightning bolt with no prior warning. But we've looked at the collection of studies now regarding aspirin therapy, and of course there's been a reinterpretation as new evidence has been gathered. And we're starting to appreciate the risk of intervening with aspirin when it comes to bleeding disorders. So yeah, the answer is yes, you can do that. There needs to be a reflection on risk benefit though. We, in some cases, have women in our practice who are on hormone therapy who've had breast cancer. It is against medical advice, against the standard of care medical advice, but for these women, they've made a judgment weighing risk versus benefit and coming out in favor of quality of life over the standard of care treatment pathway. So it's a personal decision. And this is what we advocate for in intellectual medicine. We want you to have your freedom of choice. Because something is not standard of care doesn't mean it's not right for you. It just means it's different. And it has to be balanced. We're going to talk about prostate when we come back, as we promised to. And maybe we'll talk about the AstraZeneca story as well. And maybe we'll talk about the Commerce Corporation again. I don't know. Maybe we'll wait for Wednesday.
The Commerce Corporation?
Yeah, the way they keep giving our money away to these companies.
Oh. It's always fun to talk about.
It is.
Free bottles for limited time, so call now. 800-217-1579. 800-217-1579.
What are you working for? It's about more than what you do. It's about achieving something greater for yourself and for others. So ADP is enabling people to work better and embrace new challenges. To work anywhere and everywhere. And helping everyone reach
Yep.
their full potential.
10 seconds, folks. Hang in there. So I want to wait to talk about the push-ups till I'm on air so everybody gets the benefit of hearing it.
Informed by data and designed for people. Learn more at
Shoulder,
design.adp.com.
new T.
Now, back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
36, 37, 38. Shannon, I got to get to 40. 39. Ask me why I need to get to 40. Ask me.
Why do you need to get to 40?
Because when I do 40 push-ups, I'm not going to get a heart attack. So the new study, people, correlated. So this study falls under the category of, really? You think we didn't know that? Is this not obvious? Anyhow, they found if you can do 40 or more push-ups, you're much less likely to get a heart attack than people who can do less than 10. Duh. I mean,
I can't stand these studies.
I know, right? Here's a study. If you can physically get out of bed each morning versus being incapable thereof, you're less likely to get a heart attack. Good Lord, people. Is it not self-evident by now that if you're fit and healthy, you're less likely to, be sick? Here's another study. Even if you do 40 push-ups, at some point in the future, you will die. So we get to pick how we want to live. I thought that study was goofy, really. Like, somebody spent money on that, right? Unbelievable. You know what else they spent money on, Shan? AstraZeneca spent $6.9 billion with a B for an emerging anti-cancer drug. They bought a company out of Japan. The drug so far is titled DS-8201. It's not on market yet. They're projecting it to be a $3 billion per year drug to help treat cancer. Now, Big Pharma is not intrinsically evil, people. They are myopically self-interested. So if you're Big Pharma and you're AstraZeneca, what are you betting on? And what are your actuarials telling you? You're betting on cancer really becoming even more prevalent, and your actuarials are telling you the prognosis for more cancer looks good. It looks like we're making more people that are going to grow cancer. Why do we know that? Obesity epidemic. Obesity ties into 14 and growing different kinds of cancer. In fact, if you have obesity and you're a non-smoker, the obesity is your number one cancer risk. You know what's right behind obesity, in our opinion, though it's less well studied? If your body could qualify for Superfund cleanup, the federal government would be forced to pay for your chelation. What am I talking about? Everybody we test has elevated lead. Lead is a pure toxin. It buries inside of your body. Studies have correlated it with 250,000 cardiovascular deaths per year. Cadmium is a class 1 carcinogen. If cadmium were on your front lawn, you'd have to call in the FDA, or somebody, right? Am I saying the DEM? I'm sorry, wrong thing. You'd have to call them in to clean it up because it's too toxic to handle. And yet, it's buried inside your body. You should be heavy metal tested. You should be chelating. Now back to AstraZeneca and myopic self-interest. If we attacked obesity with the same zeal and enthusiasm that we're developing drugs, the risk of disease from diabetes to cancer would plummet. There is no financial incentive for Big Pharma to do that. There's no financial incentive for established medicine to do that. They kind of benefit when you're kind of sick. Obese and chronically ill, but not quite dead, is a great recipe for healthcare profit. It's a great recipe for garbage food profit. And the obesity epidemic goes beyond diet and exercise. It has been demonstrated that diet and exercise alone is overwhelmingly ineffective in the vast majority of people. You need a medical intervention, something, and by the way, I am board certified in obesity medicine. There are other doctors in the state and the country are equally trained at a high level. You can find them by going online and looking for obesity specialists. The Obesity Society also lists these doctors. At Intellectual Medicine, we have developed an extraordinarily successful and effective and safe program for weight loss with a 95% success rate. Dr. Michael Souza at East Bay does similar things. My point is this: get to somebody who knows what they're doing. The Department of Health has been an obstruction to propagating effective obesity treatments. How do I know that? Well, because I got reprimanded by them for ordering too many labs in a patient with obesity by a bunch of people who have no knowledge about obesity and its treatment. And they're still trying to stifle this successful approach. I don't understand why. The myopic self-interest of the established medical cabal does not profit when you're healthy. Maybe that has something to do with it. Here's another thing you need to be aware of. If you have prostate cancer, just stop and do nothing. What do I mean? And by the way, these studies are on our website, right, Shan? They can read these studies. Now I'm going to talk from the research as well as my strong opinion. There's a movement within mainstream medicine for what's called active surveillance for prostate cancer. From active surveillance now is practiced by 42% of men with prostate cancer. It's a fancy way people of saying do nothing. Well, that's kind of hard to swallow if you have cancer, but it actually is good advice. There was a study done, a very important study called the Pivot trial. It's on our website. In this study, they took men who had diagnosed prostate cancer. Half of them got their prostate gland removed. The other half did nothing. Now, this was not merely people with low-risk prostate cancer. 55% of the people in the study had medium to high-risk cancers, and yet half of them opted to do nothing. 12 years later, the death rate between those that had their gland removed and those who did nothing was the same, including the death rate from prostate cancer. How can that be true? It can be true because the surgery is ineffective, because the cancer in the majority of men is indolent. It kind of sits there. Now, it is also true that in some cases, the prostate cancer can spread. We talk about the gentleman in our practice. He's had prostate cancer for 25 years, never had treatment. He feels great. He's 75. We don't advocate for doing nothing. We know some of the things that can diminish the risk of cancer in prostate that help to fight it. Things like getting your percent body fat down. Obesity stimulates prostate cancer. Things like the prescription drug metformin have been shown in studies to be toxic toward cancer cells in some cases. Vitamin C in studies has been shown to be toxic towards prostate cancer cells. At Intellectual Medicine, although it is not FDA approved, and although the outcome of this approach has not been validated in research, we use an integrative approach that includes getting your percent body fat down to its best level, intravenous vitamin C, and subcutaneous mistletoe. Often we'll weave into that mixture the sauna, the far infrared saunas that have been shown to increase body temperature and stimulate your immune system. Why do we offer this to patients with prostate cancer? Because I don't like the idea of doing absolutely nothing when we know there are things your body is doing to try to fight that cancer. I believe in supporting your body's fight. Furthermore, these interventions are harmless. They're not going to cause infertility. They're not going to cause impotence. These treatments are harmless. The safety factor is extraordinarily high. The mistletoe therapy, and we have these on our website, is being looked at in a broad array of cancers. It is not FDA approved to treat any cancer. It is not known to cure cancer, but its mechanism of action is supportive of your health in a way that possibly can have a positive impact. So we bring this to bear and we advocate to leave your gland in your body. You take it out at risk. You're guaranteed to have risk if you remove it. No guarantee to get benefit with it being pulled out. Well, we'll be talking on Wednesday. We need to expand on some of these stories and talk about some others. We're going to talk about Duke University and the way they have been faking scientific results to get federal money. We're going to talk about the AstraZeneca story, and we're going to talk about freedom and transparency in government, what it means to you. So tune us in Wednesday at noon on Facebook Live. Until then, I'm Dr. Petteruti from Intellectual Medicine, wishing you 120 youthful years. Thanks, guys, for tuning in. I hope you had fun. We'll be at it again Wednesday at noon on Facebook Live. Until then, stay healthy, live long.